Hello and welcome to the Success Showcase. I'm your host, Eric Lopkin with the Modern Observer Group. And with me, as always, is Chip Janiszewski from the Happiness and Success GPS. Chip, how you doing this week?
Doing great. How you doing, Eric?
Doing fantastic. Spring is in the air, warm temperatures. I'm getting out running. I love this weather.
Oh, I do too. You know, our West Hartford Chamber Wellness Challenge, where we're doing the steps every day, has forced me to walk every day this month rather than 3 or 4 times. And they're averaging over 8,000 steps a day, which is pretty good. So.
Oh, I've got you beat. Yesterday I topped 38,000.
Wow. Okay.
So yeah, we're.
You can do that for the next
of
podcast.
Course.
You can tell me how you did that.
There you go. Well, and the thing is, of course, there's a ringer on your team. You have an Ironman triathlete, Avi Smith-Rappaport, who's been on the podcast before.
Yep.
So it's tough keeping up with him.
Yeah, I'm actually walking with him at the West Hartford Reservoir tomorrow. So hopefully I'll still be alive on Wednesday.
Yeah. Right. Well, speaking of keeping healthy, our special guest this week, Dr. Kainkaryam. And I'm hoping I got that name right. Welcome to the show.
Thank you both for having me. Yes, and you did get it right.
All right. So, Doctor, why don't you tell our listeners a little bit about yourself, and then we'll get into, you have a very unique business model for your practice. So give our listeners a little background on who you are, and then we'll talk about that unique business model.
Yeah, sure. That'd be great. So thank you both again for having me. So I am a triple board certified physician. And so what that really means is I wear many hats. So I'm trained as an internist, which is an adult medicine specialist. I'm a pediatrician, as well as I am board certified in obesity medicine. So, I do a lot of different things, and I am a direct primary care doctor, which basically means that I practice in sort of a very unique model of primary care where it's really about the patient and less about the insurance and the third party payer. And I've been in this model before. So I've had a career journey where I've gone through, being a physician in a large hospital-owned health system, as well as done work for a healthcare startup company, VA, corrections, and in a health center, and had worked my way up the ladder to being a chief medical officer. And, a year and a half ago, decided that I don't think we give, care in this country the way I think we should. So I quit my job, went to a salary, a nice 6-figure salary to zero, to build what I think healthcare should look like. So that's what I do.
Fantastic. So let's talk about what you think healthcare should look like. And as I said, you have a unique business model. Tell our listeners a little bit about it.
Yeah, so there's a lot of terms that people use. Direct primary care is really sort of the official term, but people use a term such as subscription medicine or membership medicine, which basically, ultimately the way I describe it as take the best of the relationship with the doctor from like 70, 80 years ago and put that with the modern day approach with subscriptions like Amazon Prime or Netflix, where basically for a low monthly membership fee, you get direct access to your doctor, right? Very simple. It doesn't matter whether you have insurance or not. You may not, but at least for the primary care services, it doesn't depend on insurance. So you pay your monthly membership fee. There are no copays. There is no deductible you have to worry about. And so from a patient, you get direct access to high quality care. And from a doctor's perspective, you are freed from the bureaucracy where you don't have to worry about how many patients you need to see per hour or how much you have to code to get paid. You just focus on the patient. So it is honestly a win-win for everyone.
Yeah, it sounds like a great model. And, you said you're freed up from dealing with the bureaucracy. And I think that's something that the average person doesn't really understand about the medical profession. Prior to going into this model, how much time did you have to spend dealing with insurance, dealing with the bureaucracy just to keep everything going.
Well, look, right. So when I started my job, out of residency, one of the things was always, you have to see 2.2 patients per hour. That was the rule, right? If you didn't, then you did not make enough money to cover your overhead that the organization had. And so right from the beginning, it's instilled in you, and your medical assistant, their job was to fill your schedule, right? Their job was, I've got to get my doc 2.2 patients an hour. So if it's, and it really didn't matter, right? At that point, it was, you go in here for primary care and you have people filling your schedules with every sick visit for patients who are not yours and such, because for a while, it didn't matter who the patient was. You just had to get your schedule filled. Right. And so a lot of people don't know this. And I think there's such a eye opener. People often blame the doctors, but it's really the system that turns doctors into people they don't want to be, right? And so as a doctor, you have to bill a certain amount of money. If you don't bill a certain amount of money, guess what? You get a pay cut. If you don't see a certain number of patients, guess what? You get a pay cut. So, and I tell people doctors are always threatened by the system. So at the end of the day, you begin to forget what's good for your patients, and you begin to focus on, how am I going to keep my paycheck stable, because I've now committed things for my family. So, bureaucracy sometimes is overt with, things like insurance. And sometimes it's very subtle with, hey, doc, like, how come you didn't see as many patients? Or, hey, you belong to this large health network in the system, but you seem to be referring to another doctor outside the network. Well, why is that, right? Which really, the message is, hey, you better refer internally, otherwise you're going to get penalized. So these are all the little things that doctors go through that honestly the general public doesn't understand or know about.
Right now, of course, there's healthcare has been in the headlines for years now, trying to fix the broken system, and yet most of the solutions that the government is putting forward are about getting more people insurance. Isn't that just pushing more people into the same broken system?
Well, so insurance is not care. That's one thing I want to make very, very clear, right?
Yes.
Health insurance does not equal health care, right? I've got patients who don't have health insurance, but they get fantastic care. And yet there are stories of people who may have the Cadillac of the health plans, but yet they can't get in to see their doctor for 2 to 3 weeks, which doesn't make any sense. So right. I mean, if you think about it, I'm like, well, so one thing you got to separate is insurance and care, right? The issue for health and wellness is access to care. Insurance is simply a payment vehicle, right? And so that's the issue I have with a lot of the legislature, where it's focusing on, or how do we pay for care? It's not focusing on, wow, we've got a primary care shortage, or let's make the job of the primary care doctor better so that we have more doctors to take care of the population. So it's taking the approach, I think, very sort of only in one perspective, but is not talking about the issue, which is access.
Yeah, that's very true. And the reason I started laughing when you said people can't get in for 2 to 3 weeks is that I have a vision specialist that I need to set up an annual checkup with. And I set up my appointment this morning. My appointment is for 3 months from now.
Wow.
Because that's when I could get in. So, yeah, I completely understand what you're talking about, that insurance is not the same as getting care. And I actually had an argument with a medical receptionist at one practice a few years ago. It was mid-December, and I was ill. I might have been the flu. I don't know what it was. But I was feeling bad enough that I said, okay, I have to see a doctor. And I'm one of those people that if I'm calling a doctor, it's pretty bad. Otherwise I just go, I'll push through it. And they told me that they could see me, I think it was January 20th. And I told them flat out, by January 20th, I'll either be healthy or dead. Either way, I won't need you.
Yeah.
Yeah, and sadly, that is a reality of the system that we live in, right? And I think so. COVID has changed some things, right? It's brought to light, like, hey, like, and here's the other thing, right? And so another way I describe my practice, it's common sense medicine, right? So if you've got a rash, do you really need to be seen in person for it? Not necessarily. Let's use our common sense, right? And so there's so many things about our health system that are just designed because that's just the way things are. But you've got to begin to think out of the box because that's not what people want. And frankly speaking, people should expect more than what the health system is giving you right now.
Yeah, absolutely. I mean, what we're really talking about here is getting back to really what the purpose of medical care is in the first place, which is medical care as opposed to a business model. And obviously, that's the same with a whole lot of different professions, is that everybody's after the buck. I mean, I love the way you have this set up. I mean, you have your four E's. You have engage, educate, empower, and encourage. And what you were just talking about is engagement. And obviously, it used to be setting up an appointment to go in there, but there's so many different ways to do that. So can you talk a little bit about these? Because what you're doing right here, I think a whole lot of businesses could use the same philosophy that you're applying to medicine.
Yeah, and so the philosophy is really simple, right? It's sort of once again common sense, right? So for example, in the traditional way of doing things was you've got high cholesterol. All right, let's start seeing you. Do you really need to see someone in person for high cholesterol? Not really, right? So it's about figuring out what do you need to make the decisions that you need to make. So for example, if my patients need appointments, they typically text me first. Hey, here's what's going on. We'll have a few back and forth text messages, and then we'll decide, do I really need to drag you into my office to figure this out? Or do I know what we need to do without having to inconvenience you and pad my schedule to be able to say, oh, I saw 25 patients a day, right? Like, so, and because I don't get paid just to fill my schedule, it doesn't matter. So I can actually do what my patients need. And that has led to a very interesting phenomenon for me, right? I have patients who live in Long Island. I have patients who live in Ridgefield, Fairfield, and all the way up in Granby, Massachusetts. And, and they might work in Connecticut. So geography all of a sudden begins to become less of a barrier. And it's really about the practicality of what do I need to help solve this problem? And I think that's the thing that business owners should really think about differently. Do you need that large brick and mortar office? Or, are you able to meet the needs of your clients a different way that once again gives more flexibility? I mean, I've done things like, all right, let me meet you at your home parking lot to be able to give you these papers. I had a patient of mine who had fractured a hip. And, I had a few patients cancel. I was like, look, like I will come see you in your house because it's going to be much easier for you and it's going to be much more informative for me. So I went and saw that person in their house, right? I mean, so the things like that make a difference and change your outcomes are very powerful.
Yeah, and these are things that, a generation, 2 generations ago, people took for granted. Now it's unheard of. I mean, I don't remember the last time I heard about a doctor coming to somebody's house. So
yeah, but why not, right? That's the question: is why have we changed? And this is true for all businesses. Why have they evolved to be the current stat? Is it just because, well, that's what we think we should do and we're doing it? Or is it because it's truly a value add?
Yeah. That's just it. It's, I'm sure when people came up with these processes, they thought they were value adds, but nobody has really reevaluated them over time to see, is it really beneficial?
And medicine is especially guilty of that, right? And I think, like, take medications, right? So someone's on, oh, I don't know why I'm on this medication. I've just been on it for years, right? But I'm of the belief that everything has to be intentional. So every medication you're on, we've got to periodically be asking, why are you on this? And if you can't find a reason to be on it, then you should go off, right? And I think that's the problem: is we all get, human beings, we are beings of sort of, we don't like change. So if something is, what we think is stable, we just want to hang tight. But oftentimes you've got to have things like direct primary care and other modalities that just really shake things up and say, hey, why are we doing it this way?
Yeah, I mean that kind of going down the four E's here. You're talking a bit about education, and that's how when you're discussing things with your patients, what's the best way to go, and then the empower part of it. That's where the two of you sit down together and really figure out what's the best approach as far as what you're talking about treatments, how we're going to do it as far as getting together, and so on and so forth. But obviously, the more that you can give them control over what's going on, that's best for both of you. And um, as far as their own improvement goes, their mindset, that's where the encouragement comes in, because you got to be working on that person in the mirror at the same time, because there's a whole lot of things that have nothing to do with medicine, like the power of positivity, that's going to help make the whole thing work.
Yeah, and it's a journey, right? And so it is sequential in many ways. You sort of, your engagement is, hey, I'm here for you. Let's create this partnership. Then you build this foundation of, well, I get to know you, you get to know me, we get to know about your health, and then you sort of build this. Let me help give you the confidence that you can do this, right? As a doctor, the less my patients need me, and I mean this from a standpoint of the more empowered they are within themselves, that's a better job that I've done. But at the end of the day, they know I'm always their quarterback, but I have been able to share with them what I've learned so that they can take care of themselves. And then at the end, of course, I'm their cheerleader, right? So you're making sure that, hey, we've gone this far, let's continue going. But if you ever need to fall back, I'm always there to help you, right? And so that's, to me, that's sort of the power of this journey. And it really is a journey. It's not episodes, right? My patients interact with me throughout the year in many ways, because it is, right? Why is health this episodic care? It doesn't have to be.
Right. And of course, it really shouldn't be. There's so much to be gained from preventative medicine rather than reactive medicine. So
Yes.
I'd like to ask you, as you're adapting, over the past several weeks, I have seen a ton of technological advancements geared towards medicine for people to use at home, not the least of which is telehealth appointments with doctors, but also EKGs from the Apple Watch or gizmos you can hook up to your phone. How does this technology advance what you're doing? Is it dangerous because people don't know how to use it? I mean, what's your take on this?
Well, so you're asking someone who's got a master's in health informatics. So I'm obviously very biased. So
That's
I'm an
fine.
early adopter. I'm an early adopter of technology for multiple reasons, right? I think technology is very powerful, but I think we also have to say, hey, we're going to interpret it with caveats because we're still learning. So here's an example, right? I saw a patient earlier who had, this passing out episode, but wears a smart device that tracks a heart rate and was able to text me pictures of the trends. So to me, that was powerful. It was able to say, all right, what exactly is happening? And I was able to say, hey, I don't think this is what it is because of such and such a reason and a trend that I would expect, right? So that technology all of a sudden gave me information that the person may or may not have been able to. So I think that there's a lot of power with it. I mean, there's EKGs. I mean, I pretty much have every smart gadget I can find, and there's value, but we're still learning. So part of it is being able to say this is an additional piece of information. It may or may not be absolute, so we just have to interpret it with what we know about it so far.
Yeah, I think that's something that's very important for people to realize. Having the information and interpreting the information are two different things. And I think the greatest example of that is what I've heard referred to as the first year medical student syndrome, where suddenly they think they have everything. Now that
did I tell you that doesn't go away? That stays with you. No, I'm sure. Well, once you get it, it's there. No. But that's true, and I think as a society, we've got to think about everything with that in that context, right? So let's talk about like studies we're seeing on COVID testing and things like that. And here's an example: every test inherently has statistical value, and you've got to understand it and interpret it with it. So I've had patients who they live in the same house, everyone tested positive for COVID except for one person. It is not possible. They all had the same symptoms, same things, right? So in that case, I don't believe the test. So you've got to be able to question the world around you and be able to question tests and understand that tests are not always absolute, right? And so technology is not always absolute. So there's a judgment call, there's a level of experience, and there's an analytical piece that has to go into everything to say, does this make sense? Or are we blindly relying on technology or a test to give us an answer when that itself has limitations? So I think oftentimes we don't think about limitations of testing. We just think the test is absolute and we want a test to tell us what to do. But unfortunately, that's not always the case.
Yeah, you do have to be careful about these things. I remember back in the late 90s, I covered the internet and telecommunication sectors. And I remember seeing information on this one product. It was supposed to be a medical monitor. I don't remember if it was an EKG or blood pressure, but it was something. But the whole idea was that it was connected over the internet, and it was one of the first gadgets to connect over the internet so that your doctor could see. The problem was they didn't get the connectivity right. And if there was something else, if there was a Bluetooth transmitter, if there was a radio in the room, it interfered with the connection and gave a false reading.
Yeah.
So just because there's a test that says something, you have to make sure. That's why everybody's always told, well, get a second opinion, because you never know. The equipment could be faulty, it could be a bad test. You do need to get multiple sources of information to make sure you can interpret it correctly.
Yeah, and I think, and also just understanding that things have limitations, right? One of the things we do in medical school and in our training is we read studies, right? Oftentimes you hear articles saying, oh, this study found this and that, but you've got to step back and analyze the study to say, are there biases in this study? Who was funded? Who are the participants, right? And what are the limitations? So anytime you interpret information, you understand the limitations as well as the strength of that study. And oftentimes I think we don't think about it because we want someone to do the work for us and just say, hey, here's what you need to do. But that's where we've got to all pause and make our own judgments.
Yeah, and that's so important because, again, if one study says something, it doesn't necessarily say the correct thing. And I think the perfect example of that was a study published in Lancet years ago that connected vaccines to autism. And it got wide play. People are still talking about it. Oh, this must be what, except the study was never able to be replicated. And even the study's authors have since gone, no, you know what? We came up with the wrong conclusion. But but like newspapers where the corrections, buried the next day on page 23 for a front page error, people don't see the correction. They see that initial study.
And I think that's the hard part. And I think one lesson that COVID has taught us throughout the world as well, what we knew about, COVID kept changing. So all of a sudden people began to say, hey, we don't, things are in flux as knowledge keeps on surfacing. And what we may say one day may not be what we say a few days later. Because we've gained new information or we've looked at the data differently. So, there's a lot of gray area, a lot of judgment area that you've got to not be so absolutist in so many ways.
Absolutely. People tend to talk to their doctors and think, well, they're a doctor. They must know everything. They must have all the information. And the truth is, as new things happen, we get more information. Information changes. And, doctors are only human. They're learning along with the rest of us.
Yeah. Yeah. And so much of it's probability, right? So much of it is, here is the likelihood is high for this, right? There's very few things in medicine that we can say it's a definitive yes or a definitive no. A lot of what we do is probability. And then what you begin to do is say, let's do X, Y, and Z so that we keep on changing that probability that arrives, that helps us arrive closer and closer to the most likely diagnosis.
Great. So you've switched over to this direct business model. Who have you seen being the most receptive to this? Is it younger people who are generally, earlier adopters of things? Is it older people that, love the idea of having a house call or, remember when medicine was like that? Who has really responded to this?
Yeah, that sort of has been interesting for me to watch from my end. I can probably split my demographics of my patients in so many different ways because everyone's got pain points. And let me just give you a few examples, right? So let's go to the younger folks. Let's kind of go chronologically. You've got younger families with kids. And so think about this, right? As a parent with kids, wouldn't it be so much easier if you could just text your kid's doctor or say, hey, can we do a house call? Because I've got 2 or 3 other kids at home that I got to manage, right? So you've got young families who are like, wow, this is great. Then we go into the adolescents who, really, may or may not want to talk to their doctor, but, I just wish I could text my doctor this question, right? And I had someone text me about, a mass that they had that they probably wouldn't have directly told their parent. So the adolescents begin to develop a relationship with their doctor that is independent of their parents because they can have that direct communication. Then you've got sort of your folks in 20s and 30s who are very busy, just don't really have time to take 3 hours out of my day to go see my doctor. Wouldn't it be easy if I could have that relationship where access was direct? And so that's their value. Then you've got sort of 40s and 50s and 60s who are really focused on prevention and want someone to make sure that they're following the guidelines and getting their screenings. And then you've got your folks who are above 65 and elderly who really just need a doctor to kind of keep that whole big picture in mind, coordinate their specialists. So everyone from an age standpoint has value. Everyone from a insurance standpoint. I have patients with insurance who just want great care. I have patients with high deductibles who know that, we're going to pay out of pocket till we hit that deductible. And our doctor is going to help us save money on medications, on labs. And that's because I have my own rates for medications and labs and things like that they don't have to use their insurance for and saves them money. So you've got that cohort. And then I've got patients who are undocumented, uninsured, that they can still have fantastic care. And whether it's an individual or a business, a lot of my patients are business owners or have businesses where they've signed up their employees. Now all of a sudden, think of this differently, right? As a business owner, you can give your employees copay free primary care, whether or not you can give them insurance or other benefits. So what does that do to your productivity? What does that do to your employee who's sick and who can't get to their doctor for 2 weeks? And now your business is suffering because they're not able to get access to care. So all of a sudden, if you really think about it, everyone wins in this model, which is why I believe so strongly in it.
That's fantastic. Now, we're coming up on the end of our time. So if any of our listeners want more information or would like to find out how they can sign up as a patient, how can they do that?
Yeah, so all the information's on my website. So you can go to www.4elements, ELEMENTS, DPC, that stands for Direct Primary Care, so dpc.com. Or honestly, many people just shoot me a text message at my office number, 860-469-5646. I get all the messages directly, and I'm the one who responds. So once again, direct access.
Fantastic. So, Chip, what do you think is the big takeaway for our listeners this week?
I've just loved listening to this whole thing, especially as somebody who's been through all the demographics that you just mentioned. But, house calls, it's like getting back to a 20th century history book. But I love the Facebook page I looked at today with the diagram of you with your picture, and underneath it says the power of influence. And it says, I can look every patient in the eyes and say, I am not influenced by insurance. I am not influenced by a health system. I am not influenced by a corporate culture. I am only influenced by one thing, you. And that describes what being a true medical professional is all about. It's about the patient. So it's just such a wonderful business model, and I really, really hope it catches on. And I hope you're teaching a whole lot of people how to do this, and that the word spreads. So thanks so much for being with us. It's been a pleasure to meet you.
Oh, thank you both.
Yeah, I think the big takeaway for me is that this is a business model that potentially can help fix the healthcare system. And people need to look for these models and look for physicians that are doing this, because it's so much better than the care you're going to get by going through your insurance provider. And dealing with a doctor that has to deal with the limitations that you talked about earlier on, where they have to get 2.2 patients in there an hour. So thank you so much for being our guest this week.
No, thank you both. And, I'm really glad to be on here, and I've been following your podcast. So it's always fun to listen as well. So thank you.
Thank you. You've been listening to the Success Showcase. You can catch us every week at xvadio.com/podcasts. You can also find us on the Apple Podcasts app, Google Podcasts, Spotify, iHeartRadio, Stitcher, and wherever you find podcasts. Remember, make this your best week ever and make next week even better. We'll see you then.